And Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor. You've said before you're a dad of 2 teenagers. Both are fully vaccinated. So can they now attend school without masks?
It's good news, Maria. They can attend school now. Masks are optional in Needham. And I think that's a great idea. And it's important that we've reached a time in the pandemic when it's quieter. Cases are going down, hospitalizations are going down, deaths are going down more slowly. But that's good news. And I think it's during these quieter times when you want to have personal choice autonomy. But remember, when cases are surging, then that's the time when you really have to enforce some of these mandates.
Okay, Dr. T, there is other big news this week about COVID and kids, and this time it comes from Florida. The state's Surgeon General, again, this is Florida, is now urging parents not to vaccinate their children against COVID. I know you're not that person, but why might that be? Do you have a professional opinion?
Ed, you know that I think this is a bad idea, and you've heard me say this before. When politics interferes with an effective public health response, bad things happen. Remember, this vaccine decreases the likelihood that children will be hospitalized, even though Omicron has been able to evade these vaccines. So the vaccines have had reduced effectiveness in both kids and adults as far as getting infected. They have been very good in reducing the likelihood of hospitalization. I want you to think for a second what Paul Farmer would say about this. Someone who spent his life trying to bring resources and better health care to the poorest parts of the world, to think that we have a key resource that is in abundance, but there are leaders that are saying they're not going to use it. That's not okay. What this guarantees for Florida is when the next COVID wave hits, that there are going to be increasing pediatric hospitalizations there, disproportionate to other states.
Speaking of kids, Doctor, kids as young as 5, as we've been reporting, they've been eligible for the Pfizer vaccine since November. So far, have you seen any benefits? What benefits have you seen?
So recent publication in the MMWR, actually this was a preprint from the New York State Department of Public Health, that basically said that while there was a reduction in effectiveness with the vaccine in kids 5 to 11, it went from about 65% down to about 12% in reducing infection. That was disappointing, but there was still a 50% reduction in hospitalization. So just like I said before, what we're seeing is the hospitalized kids with COVID have not been vaccinated.
So Dr. T, let's take a closer look at how the vaccination rates for kids here in Massachusetts compare to the national rate. And the age groups don't quite sync up perfectly. But as you can see in this graphic, in every age group, the percentage is significantly higher here. Any signs of serious side effects that you've seen?
The vaccine continues to be extremely safe and extremely effective at reducing hospitalizations, even though there is a reduction in how well they're doing against preventing infection, which is basically in the back of our nose where you can spread it from one person to another. I do want to say one thing. It's important that the pharmaceutical companies, and they're doing this, help develop next generation vaccines that are even better than these vaccines at reducing the likelihood of infection. And hopefully that's coming sooner than later.
Dr. Todd Eller in South Shore Health. Thank you so much, Doctor. Be well.
You too, guys.